All right, let's dive right into this explainer. Did you know that in a busy critical care unit, a clinical alarm can sound up to 900 times per patient per day? Yeah, that is a staggering amount of noise, and it creates one of the absolute most pressing communication pain points in healthcare facilities today. If you've ever spent time managing or working in a busy hospital, you know for a fact that clear, immediate communication isn't just a nice to have convenience, it is absolutely critical to patient safety and operational efficiency. So today, we're unpacking a really well-structured, comprehensive solution from Tellercom called Tellercare. Here is the roadmap for how we're breaking this down today. First, the nurse call dilemma, then we'll meet the Tellercare system, look at smart features and benefits, explore hardware and system components, cover models for every facility, and wrap up with proven real-world success. Let's get into it. Section 1. The nurse call dilemma. The hidden chaos of hospital operations. I really want you to ask yourself a tough question right now. Is your facility suffering from the common failures of traditional communication systems? We're talking about those complicated, completely non-intuitive interfaces that just confuse patients when they're at their most vulnerable. We're talking about systems that generate way too many irrelevant alerts, leading to dangerous alert fatigue, where critical calls literally just get lost in the overwhelming noise. Add in delayed alerting, a total lack of data to analyze response times, and the absolute nightmare of high maintenance costs, well, it becomes a massive, exhausting operational bottleneck for your staff. Think about the stark contrast between that old, frustrating tangle of delays and the streamlined, data-driven approach Tellercare brings to the table. Instead of dealing with alert fatigue and high costs, Tellercom counters those exact issues with user-friendly visual cues that are designed for incredibly diverse demographics. They use smart alerts that actually prioritize notifications, real-time alerting with super low latency, and a transparent, low-maintenance design that significantly reduces your technical downtime. It's a total game changer. Section 2. Meet the Tellercare system, a comprehensive, scalable remedy. So, established back in 2016, Tellercom engineered this system, Tellercare, to be highly adaptable. It's an advanced communication system, and its primary goal is simple: ensuring patients can reliably alert caregivers the exact moment they need assistance. What makes this really fascinating is that their products are built to suit every single format of a healthcare facility and its specific workflow. Whether you need a simple wired setup or a fully integrated wireless system, it's literally designed to mold to your existing infrastructure. Section 3. Smart features and benefits. Upgrading the infrastructure. Let's think about how these features play out in a real-world scenario. Picture a code blue. A multi-function switch right at the bedside escalates that call instantly, automatically prioritizing it above, say, a routine housekeeping request. Meanwhile, behind the scenes, the system logs the exact response time to give administrators incredibly detailed call log reports for performance monitoring. And for the engineering team, well, the system actually runs self-diagnostics, so they know about a fault before it ever turns into a major crisis. Now, underpinning the whole shebang is a critical standard, VDE 0834 compliance. This is not just some regulatory checkbox. It's a strict international benchmark that ensures the absolute highest global safety and reliability standards for nurse call systems. Basically, it means hospital administrators can rest easy knowing their infrastructure is built to a globally recognized standard of safety. Section 4. Hardware and system components. Beautiful, intuitive design. When a patient is in distress, the very last thing they should have to do is solve a puzzle, right? The main bed switch is incredibly intuitive. It features a green button with a super clear icon for a nurse and an orange button for housekeeping. That clear, color-coded design completely eliminates guesswork for diverse and potentially overwhelmed patient demographics. They know exactly what to push without any hesitation whatsoever. And by integrating housekeeping, nursing, and other services into unified switch form factors, the chaotic tangle of multiple cords and buttons hanging around a room is finally eliminated. This deliberate reduction in bedside clutter is huge. It keeps the patient environment calm, clean, and highly functional. All of those individual bedside alerts funnel directly into the brain of the operation, the TellerX Nurse Station Hub. For the staff, this translates to total situational awareness at a single glance. The touchscreen maps out the ward with immediate, color-coded statuses. Green is clear, red is an active alert, and a distinctive blue flags a specialized need in a specific room. When you combine that with multilingual support, multi-call announcements, and even WhatsApp and SMS integration, nurses are never left guessing where they need to be or what the priority is. Section 5. Models for every facility. Configuring your specific setup. Tellercare essentially scales to fit the reality of your budget and infrastructure. A sprawling hospital campus, for example, might require the massive networked-based system to get centralized control and advanced analytics. On the flip side, a boutique specialized clinic might opt for the premium tier with concealed wiring for a much cleaner aesthetic. Or maybe you just need a simple standalone setup for a rapid, easy install in a smaller ward. The point is, there is a specific, cost-effective configuration mapped out for absolutely every operational footprint. Section 6. Proven real-world success. The data-driven climax. Over 20,000. That is the massive number of these durable, reliable Tellercare devices that have already been installed and stress-tested out in the field. So we're not talking about a prototype here. It's a deeply established, highly trusted solution. And we are talking about immense daily patient volume. Narayana Hridayala utilizes 357 switches in a centralized server. HCG Hospitals manages 485 switches. Manipal Hospitals operates 265 switches. These are absolute prestige institutions, and they trust Tellercare to seamlessly handle communications across their critical care networks every single day. With over 20,000 installations proving that intelligent communication infrastructure saves both precious staff time and patient lives, it really begs a crucial question. If a hospital's primary goal is to heal, can it truly afford to rely on communication systems that cause fatigue and delay? Think about it. Thank you so much for joining me for this explainer. I really hope this analysis has sparked some serious, data-driven conversations about the hidden potential inside your